Today we're here to discuss the debate whether or not big pharma's cancer is suppressing research for the cure and prevention of cancer to profit from the extensive and expensive treatments needed. It is irrevocably true that the companies are doing this as they are polluting the air and the body. There are multiple home remedies, and there was a cure for cancer that was benched despite its success. A survey carried out by a nonprofit organization, Access to Medicine Foundation, found that just 8 of the 18 companies questioned said that they set limits regarding how much antibiotic discharge could be released into wastewater. In this survey, which involved big pharma names like Novartis, Roche, and GSK, and genetic drug makers, none of the respondents were willing to disclose how much antibiotic discharge they are releasing into the environment. This is troubling due to the fact that according to the Global Issue Report in 2016, antibiotic waste that leaks into the environment from manufacturing pharmaceuticals is a big driver on microbial resistance. When bacteria is exposed to the antibiotic residue in the environment, it can quickly build up full resistance and spread, fueling the superbug problem that is currently plaguing human health. In fact, the resultant superbugs are spreading across the planet and turning problems that were once easily treatable into life-threatening conditions. Not having effective antibiotics is making it difficult to treat the infections. Every common medical procedures like C-sections and joint replacements are becoming quite risky as a result. In 2017, Britain's top doctor said that cancer may become untreatable due to drug-resistant superbugs that can wipe out 100 years of modern medicines. Professor Dame Sally Davies and government chief medical officer sounded the alarm after the first case of death from a bug could not be treated by all 26 antibiotics available to medics. BBC projects that in 2050, the superbugs will be the cause of over 10 million deaths. There are many cancer preventative techniques and even home remedies that are dismissed as fictions or lies, but the following have been used for years, long before the big companies started offering up their own solutions, before the cancer diagnosis rate was so high. First up is the hemp seed oil. It does not contain the psychoactive THC ingredient used by people who smoke, and a member of the Acanay family of fruits. It's regarded as a superfood due to its unique ratio of omega-3 to omega-6 essentially fatty acids, and contains up to 5% pure GLA, which is even higher than the spirulina. For thousands of years, hemp seed oil has been used in elixirs and medicinal teas to provide anti-mutagenic action, which prevents genetic damage by free radicals and or radiation. Another method is the reishi mushroom. Simply go to health food stores and check the supplements and dried powders, usually sold as capsules. Reishi have been used to treat countless ailments in the Far East for over 2 millennia. In China, they're called the mushrooms of immortality. They are meant for long-term consumption and have been linked to reduce blood pressure and improve nerve function and stamina. These are just 2 of the cheap, easy ways to prevent and or cure cancer that are not advertised by the companies. Moving on, in 2010, a pharmaceutical chemist, John Hood, had amazing news. A drug giant, Sanofi, brought Tanger Green, the company at which he headed the research, for $650 million. That meant that Fedratinib, a cancer drug he co-invented, should have made a smooth path to the market, but it wasn't so. In 2013, Sanofi ended development on the drug after he claimed that cases of Wenski's encephalopathy, very high in essential fatty acid content, and leuropathy, a vitamin B deficiency that causes confusion and or loss of vision, appeared in clinical trials. Hood, however, says he didn't agree. Neither, he says, the patients on the trial. They were asking for help to get the drug back. They were dying. Most of them died, said Hood, who's the intern served as a chief scientific officer of regenerative medicine in Unicorn Salmon. It was very motivating to try to get it back. This is proof towards big pharma's guilt. They suppress an actual cancer cure, a cure that could potentially have saved the 2,952,000 lives that have died from cancer since this. These few arguments are among the many that are raising eyebrows at the true motives of big pharma's cancer. It's not like they have nothing to gain. In 2010, the Cancer Research Study reports that US, 1 in 2 women and 1 in 3 men will develop cancer. They state the child born in 2010 onwards will have a 1 in 2 chance of being diagnosed with cancer. This is testament to the human morality and puts things into perspective. Things like the fact that in the early 1900s, 1 in 20 people developed cancer. In the 1940s, 1 in 16 people developed cancer. And in the 1970s, 1 in 10. Notice the steadily rising numbers. Estimated the national expenditures for cancer care in the United States in 2017 is $147.3 billion. In future years, costs are likely to increase as the population ages and cancer prevalence increases. Costs are more likely to increase as new and often more expensive treatments are adopted as standards of care. If the cases are rising and they're getting more expensive, the companies are making more money. This gives them clear motive to do the things they are doing. Thank you.
Your turn.
Okay, thank you so much. Just for time's sake, we were hoping to limit each argument section to about 3 minutes. So
3 to 4 minutes.
3 to 4 minutes. And we'll begin now. Yeah.
Pharmaceuticals have many positive impacts on a patient's health. Herbal remedies are tempting to take, although they aren't as effective as pharmaceuticals due to the low impact they have on a patient's health and their inability to treat illnesses as effectively. Over-the-counter drugs provide safer and faster recovery than herbs. Alternative medications generally take much longer than conventional medications to treat an illness, and therefore are not as effective as conventional medications. Pharmaceuticals are also more effective for issues involving the heart, brain, and other major organs. This is because pharmaceutical drugs are designed to be more effective on specific areas, while alternatives are more generalized. The use of alternatives can also present issues when faced with a malady that result in the loss of function to an organ. In this case, one would need treatment that works fast and will target the afflicted organ.
Alternatives will fail the organ quickly enough, likely resulting in life-altering consequences. Unlike home remedies, pharmaceuticals are prescribed by health professionals. This means that over-the-counter medicines are more assured to be safe in prescribed using than alternative medicines, thus creating less risk of gastrointestinal symptoms and allergic reactions. Herbal remedies are considered dietary supplements instead of actual medicines as they are known for weight loss and skin treatment. This is because prescribed drugs have been tested and researched with many health requirements set by the government, creating a safer product for consumers. Home remedies, on the other hand, have no requirements and restrictions set, keeping the chance of overdoing a treatment as a possibility. The growing popularity for alternative medicines is not without reason. It is because they work. However, alternative medicines are not and will never be as fast, reliable, and effective as pharmaceutical medicines. Thank you.
Okay. You said that the non-traditional ways to cure cancer are generalized, but the Gerson therapy and juicing, Albert Schweitzer, MD, Nobel Peace Prize winner of 1952, he said, "I see in him one of the most eminent geniuses in the history of medicine. Many of the basic ideas had been adopted without having his name connected to them, yet he's achieved more than seemed possible under the adverse consequences. He leaves a legacy which commands attention and will ensure him in due place. Those of whom he cured will now attest to the truth of his ideas." His ideas.
Sorry, I'm really sorry to interrupt, but have you started the rebuttal? Because we were kind of thinking that it would be your argument, our argument, and then our second arguments, and then we would have a long rebuttal period at the end.
Okay.
So I don't know if you.
I'm sorry, could you repeat that one more time, sir?
Yeah, we'll consider.
Okay.
Regulating the environmental impact of pharmaceuticals concerned by environmentalists, regulators, and manufacturers rises over the environmental impact of pharmaceuticals. June 2nd, 2014 by Sean Milmo, Pharmaceutical Technology, Volume 38, issues 6 pressures mounting on European legislators to introduce tighter regulations at both of the European Union and national levels on the potentially harmful impact of pharmaceuticals on the environment. Politicians, environmentalists, and even medicines regulators are calling for the action in the face of increasing evidence the pharmaceutical chemicals used through the whole life cycle of medicines from production through to disposal are posing a bigger than previously anticipated threat to the environment. There are, however, divided opinions on what needs to be done, and some groups want stricter regulation of product processes, more consideration of environmental issues when market authorizations are granted, and more rigorous rules on disposal of pharmaceuticals. Some regulators, environmentalists, and fine chemical producers support suggestions that tougher environmental standards should be applied to imported APIs. This increase in standards could be done by extending rules on GMPs to environmental protection. Others, particularly
90 seconds remaining.
most parts of the pharmaceutical industry, believe that the voluntary initiatives should be sufficient to eliminate the dangers of medicines in the environment. The European Federation of Pharmaceutical Industries and Associations representing research-based companies concedes that the public wants more information about the risks from the concentrations of certain medicines in the environment. We believe that the voluntary initiatives might be a relatively fast and flexible way of dealing with this issue, says the Pharmaceutical Industries Association. The European Commission appears to be taking its time on the issue.
Remaining.
The Commission is expected to release shortly a study it has funded on the environmental risk of pharmaceuticals after its publication was postponed last year. In 2015, the Commission is scheduled to issue a strategy document outlining ideas for new regulatory measures, after which it will have the opinions to draw up a draft legislation. Some countries may not wait for specific proposals by the European Commission. Instead, they could enact their own regulatory schemes. This effort could happen among groups of states. Countries bordering the Rhine have, for example, already put forward ideas for international regulations to protect the river from pollutants such as pharmaceuticals. The countries most concerned about the pharmaceutical environment threats are Scandinavian states, Germany, and its German-speaking neighbors. Sweden has been particularly active in lobbying other EU states for the EU regulations to ensure all risks are associated with the environment.
Thank you so much. We're now going to move on to our second argument. Okay, so now to talk about our political and global argument. Using big pharmaceutical treatment is more beneficial for the public because it allows countries to collaborate and create better medical advances. Firstly, there have been many organizations founded that allow scientists to talk globally about their discoveries. For example, the World Health Organization, a worldwide specialized agency of the United Nations that is concerned with international public health, has made a lot of progress in health research and has helped many countries overcome epidemics. There's also the American Red Cross Foundation, which has used pharmaceutical equipment to rescue people surviving a crisis. The further advancement of this technology helps countries share information that helps the general public. For example, during the Ebola epidemic that occurred a few years ago, scientists from around the world came together in order to find a cure. They have used traditional medicine, like pills and such, to create a vaccine that can cure the deadly virus. In a study performed in 2015, a total of 5,837 people were given the RVSV-ZBOB vaccine, and none have recorded a case of Ebola after 10 days or longer. This is from the U.S. National Library of Medical National Health Institutes of Health. This vaccine was primarily funded by the World Health Organization, along with other associations such as the Public Health Agency of Canada.
Furthermore, in terms of politics, sharing scientific information has helped countries communicate during times of conflict. While political tensions can run high, the desire for progress in scientific knowledge is not affected by this. Currently, even though the political atmosphere between America and North Korea remains high, their scientists are still collaborating. They have been communicating with each other in order to develop a way to detect drug-resistant tuberculosis. Lastly, these traditional medications help to eradicate diseases worldwide. For example, years ago, many places around the world were infected by the smallpox disease. Smallpox is an extremely contagious and deadly virus for which there is no known cure. However, thanks to collaborators around the World Health Organization was able to create a vaccination to treat this disease. Recently, scientists around the world are working towards eliminating polio. According to a recent study, 180 countries are considered polio-free thanks to the traditional medication and global efforts. Also, in September 2015, the World Health Organization created guidelines for public health emergencies. These guidelines specifically state that every researcher that engages in generation of information related to a public health emergency or acute public health event with the potential to progress to an emergency has a fundamental moral obligation to share preliminary results.
Therefore, using the big pharmaceutical medications are better because it helps create a more bond and more communication with other countries. Thank you.
Thank you very much. Our third speaker. Jimmy? Go. As our opposing counsel stated, it is helping the public. Actually, Big Pharma is slowing the cancer research. In a March 27th article in the New England Journal of Medical and team led by physicians at the Massachusetts General Hospital revealed that a new cancer-bearing drug from Novartis has shown exceeding clinical results in a small trial of lung cancer patients. While in addition, trials are necessary before the drug can obtain approval for the Food and Drug Administration. This type of success story demonstrates why research to develop new cancer therapies is critically important. Researchers in academia, biotech, and pharmaceutical companies are making remarkable discoveries to help identify new drugs and drug targets for cancer patients. Many new compounds are under investigation, including those that inhibit the growth of cancer cells, block the blood supply to tumors, and prevent tumors from invading the immune system. Even as scientists seek to bring a new cancer treatment to the market, however, drug-patient issues are holding back some researchers. A major hurdle is in combination drug trials that test two or more therapies at once. Pharmaceutical companies often shy away from trials that have great potential because the drug may not generate profits if they are used together with a generic drug or a drug patented by a different company. Recently, there have been major advances in our understanding of how cancer progresses. As scientists have sequenced thousands of cancer genomes, patterns are starting to emerge. One clear insight we have gained is the likelihood that no single drug will be able to defeat cancer. The reason most cancers become drug resistant and come back is because their DNA mutates quickly. Cancer cells are not killed by the drugs survived, continuing to grow and replace the cells that have been wiped out. So how can we beat the evolution of cancer cells? Most cancer researchers believe that the way to do it is some drugs approach that holds HIV in check for AIDS patients with combinations of drugs. The drug cocktails is used appropriately may someday control many cancers because the cells resistant to one drug will be sensitive to another. The great challenge is figuring out which drug combinations are likely to work best. But when it comes to clinical trials that are necessary to bring out combinations to market, there are two major hurdles. The first hurdle occurs when the drug has neither company wants to fund or trial, And second, the second obstacle can arise when there are no patient protection and thus no financial initiative to test a cocktail in the market if it works. Thank you.
Hi, sorry, okay. So earlier you were talking about how like cancer is kind of incurable because bacteria is always changing, so we obviously can't monitor that all the time, so we can't use the same cancer treatments. But that's the thing. When it comes to pharmaceuticals companies, they're always finding new treatments because they're always going through clinical trials, whilst home remedies are known to be used for long periods of time. Because so if bacteria is changing, shouldn't home remedies change with them?
Do you have another speech? I thought we were in the speech periods.
No, we only had 2 arguments. We wanted to move. We assumed that we were doing rebuttaling, but
Okay,
we could just start rebuttaling.
Go ahead, repeat your question.
Okay.
Go ahead, repeat your question. We'll rebut or whatever you're going to do. Could you repeat your comment, please?
Yes, for sure. Okay, so basically, we were bringing up the fact that someone from your previous arguments was talking about how bacteria is always changing and how treatments are not always there to like cure that bacteria. But the fact of the matter is that many companies are constantly changing and making variations and constantly creating new drugs to fight off these bacteria and to help cancer patients. Whereas home remedies are known to stay constant, they're the same. There aren't necessarily new home remedies, but there's always new drugs on the market.
Are you saying that new home remedies are needed?
No, I'm not saying new home remedies are needed. I'm saying that drugs are more effective because they're constantly changing and they're keeping up with new diseases and new bacteria being introduced, whereas home remedies are constant and they don't necessarily change, which is why they're not very useful in the long run to help treat patients.
If the home remedies work, why would
Okay, well, in addition to that, there are always groups of researchers and scientists trying to come up with new treatments and new drugs every single day, and people devote their lives to those kind of things. But with home remedies, there are no like constant and sustainable groups of research continuously coming up with new things.
And there isn't necessarily much research backing up the fact that home remedies actually work.
They came up with money.
So what is the main focus of a pharmaceutical company?
To create drugs to help patients fight their disease.
Correct or incorrect? It is to make money and money alone.
Correct or incorrect? A polio vaccine saved your life and helped you not get polio.
Incorrect, right?
the polio vaccine is actually the causes of cancer. If you want these.
Okay. Well, it was just an example.
It was an example. Our argument is actually that drugs are created to, whether they're for profit or not, any kind of company, any kind of research association, they need funding to be able to continue on with their research, therefore making your point moot, because every single institution needs money to continue running and continue working. So how are these companies going to produce new drugs if they don't have money to do the research?
Furthermore, in Canada, the fact of making drugs is not about making profit, because our healthcare is free. So pharmaceutical companies are here to help us fight our diseases, not necessarily make money off of us because we have free healthcare.
Go ahead. You just stated that they need funds to do research. Therefore, you're saying that they're taking more time to find funds than they are trying to find a cure. Because anybody can go on their Facebook.
The Canadian government pays for research and funding. We have our National Institute of Research in Ottawa, where the Canadian government pays for our pharmaceutical companies to research for us.
In America,
In addition,
so that is not worldwide. Not everyone has, and in some corporations, here we know that corporations, their goal is to make money. So why would we not use a home remedy where their goal is to cure?
So let's level the playing field and talk about in general, because over here, pharmaceutical companies aren't necessarily there to make profit. Well, in America there is. So I don't think we should necessarily discuss this because we're from two completely different regions.
Also, there was also a point said that the polio vaccine, correct me if I'm wrong, the polio vaccine caused cancer. There actually been no known cases that caused cancer in humans. Yes, it did happen in rodents. However, research suggests that the virus didn't directly cause cancer. That polio vaccine did not cause the cancer. There was a case with the rodents that this did happen, but not necessarily with humans.
Okay. You said that the vaccines did not cause the cancer, but vaccines are just another of conventional medicine's colossal blunders. The absurd idea that vaccines protect you from infectious diseases and increase immunity are blatantly false. Health authorities credit vaccines for disease declines and assure us of the safety and effectiveness, yet these assurances are directly contradicted by the government statistics, published medical studies, and FDA and CDC reports, and the opinions of credible research scientists globally.
Vaccines are specifically made to protect your body. Over here in Canada, it is recommended and it is actually required for us to actually have certain vaccines like the hepatitis B and other vaccines, or else here in Canada we will be suspended from school unless we have it. So vaccines are actually really important, and they don't cause illnesses. They actually protect your body from getting illnesses.
and I'm sure your schools have that too.
Yeah. To argue your point about vaccines are not meant. They are meant to help the body, but vaccines contain additives, preservatives, and injections, which are supposedly to increase the body's immune response to the vaccine. Substances like mercury, aluminum, formaldehyde, MSG, squalene, and antifreeze. Medicinal research has well established that the direct injection of foreign proteins and other toxic materials make the recipient more, not less, easily affected by what he or she encounters in the future. This means that they do the opposite of immunize, commonly even preventing immunity from developing after natural exposure.
Even though there are side effects to everything, vaccines have done more good than harm to specifically children, as we have been able to eradicate things like mumps, rubella, and polio in various places around the world. And so therefore, vaccines have actually ended up helping people. Natural remedies, I don't believe, can cure polio. I don't believe natural remedies can help you with mumps and things like that. So therefore, we do need big pharmaceutical companies to make these drugs in order to save kids from dying. If you look back at the 90s and before the 90s and like the 70s and the 60s, so many people died from polio. So many people died from simple things like mumps and rubella. But now we have these drugs there to help us. I don't think a lot of us would be here today without those vaccines.
Spanish influenza.
Such as there's a vaccine that eradicated the Spanish influenza. A lot of people died from the influenza way back when. But now we don't have that anymore.
You stated earlier that the vaccines help specifically children, but did you know that autism rates autism rates in developing countries have risen remarkably in the past 20 years? For children born in 1992, according to the U.S. CDC, and about 1 in 150 will be diagnosed with autism spectrum disorder, ASD. For children born in 2004, about 1 in 68 children will receive an ASD diagnosis. This has been tied to vaccines. So how can you say it helps children if this is happening?
It's more harming them than it is curing them.
There have been actually many scientific researchers that have disproven that vaccines cause autism. There was one researcher who published a false article, a false paper, scientific paper about autism and some correlation between autism and vaccines, and that man is actually in prison today because of that false paper. So there actually have been no records anywhere or no correlation between autism and cancer. And I mean vaccines, sorry.
Come on, continue.
Okay. Anonymous source. Okay. You repeatedly quoted anonymous sources in your arguments. Can you verify that information?
We're on fact checking right now because our Wi-Fi is running.
The name is Dr. Andrew Wakefield, and his license to practice medicine in the United Kingdom was actually taken away due to this. And he went to prison.
Correlation. That is just one example. If you would like us to find another, our Wi-Fi is also running a bit slow. We'll have one soon.
May I ask where you guys found the point of how vaccines cause autism?
I'm sorry, it's right over. We got this from the History of Vaccines and Educational Research by the College of Physicians of Philadelphia.
Thank you.
You're welcome. So good. Go to your next report.
So while we're sorry. No, okay. While we're fact checking, I just want to talk about a point that was brought up before about how the ingredients in vaccines may not be safe. There are actually ingredients such as, thimerosal, aluminum that can be harmful in large quantities, but they are not used in harmful quantities in vaccines. Children are exposed to more aluminum in breast milk and infant formula than they're exposed to in vaccines. So while there can be harmful ingredients in large doses, they don't actually put those large doses, and they don't give it to children like that because it is harmful.
And also these vaccines are regulated by many, many associations that we mentioned earlier, like the World Health Organization, the FDA, the American Medical Association. Just many associations have been regulating these vaccinations. They wouldn't be giving it to people if they were harmful and causing autism.
You said earlier that the non-traditional methods were not as effective, but the following statements disregard this notion completely. Albert Schweitzer, MD, Nobel Peace Prize winner of 1952, is quoted as, "I see him in one of the most eminent geniuses in the history of medicine. Many of the basic ideas have been adapted without having his name connected to him. Yet he has achieved more than seemed possible under adverse conditions. He leaves a legacy which commands attention and will ensure him in due place. Those whom he have cured will now attest to the truth of his idea." He was referring to Dr. Max Gerson, the German-born American medical doctor who developed one of the most effective natural cancer treatments over 90 years ago. Coined the Gerson therapy, Dr. Gerson helped hundreds of cancer patients activate their body's extraordinary ability to heal itself.
For your point.
Also about before where you were saying you got your sources, I actually checked the exact same source, and the conclusion was found that this is a direct quote, most scientific and medical experts are satisfied that no connection exists between vaccines and autism and other neurodevelopmental disorders.
Furthermore, the vaccine ingredient that was linked to autism was called thimerosal and is no longer used in most childhood vaccines, and so therefore, for the past few years, that's no longer used. So that claim doesn't really count. 1952. Go ahead.
And they
Took it out because it was harmful.
Sorry, can you please repeat?
You said that it was taken out because it was harmful, correct?
Yes.
And that was only corrected a few years ago? So you agree that vaccines are harmful to the human body, to children?
We do not.
Taken out of children 5 years ago.
I'm sorry, can I talk? Thank you. No, many researchers believe that it was linked to it, and therefore they decided to take it out, but there was no conclusive evidence that actually linked it. They just, for a safety precaution, decided to take that specific ingredient out.
Like, so you're saying that you said large amount of quantities in vaccines aren't harmful. So you're saying that putting antifreeze in a child's body is not harmful, despite how great the limit is or how small the limit is. Putting antifreeze in someone's body is not harmful.
Sorry, putting what in a child's body is harmful?
There is antifreeze in viruses. So you're saying that in harmful viruses, there are not large amounts of vaccines or quantities inside the vaccine as an example of aluminum and mercury. So you're saying that despite how large it is, it's still not harmful to someone.
Okay, so same concept. What about if a child had rubella? Do you think treating them with something like a natural remedy, like people sometimes put honey on kids and stuff like that, would help them treat their rubella? No, the vaccine will help them get over that rubella.
Actually, we're not saying home remedies like honey. We're saying home remedies like the Gerson therapy and juicing, how it works, the diet, the Budwin protocol, all certified by PhD holders and So
a baby can go on a diet and a baby can juice.
Actually, it says right here.
For example, a baby died from meningitis when their parents tried to treat it with herbal remedies, and it did not end up working because the parents refused to take the meningitis vaccine, and the baby ended up dying.
Well, that is because they were not informed about all of the techniques and home remedies used. If the big pharmaceutical companies would stop repressing this research, then we could in fact inform them of these cheaper, healthier ways.
So when a baby has contracted meningitis and has just started to get sick, the parents should sit down, take a long time researching all the methods and everything out there to help their baby, which could take about months, when they could just take a simple vaccine and they could cure their baby even before the problem could have started.
And their doctor should give them all the options, not just options that the big pharmaceutical companies want them to hear.
Sponsored by the government, which you stated earlier, tied back to funding, which they have to take more time on instead of researching all of the options.
Restating our point, those parents refuse to use the meningitis vaccination and other treatments because there are other treatments.
We are not that example.
We're talking about an example, which is what we use here. We use examples to verify our points.
You said that they refuse the vaccine after. The vaccines don't cure. They treat before, they prevent before, but they do not cure, correct?
And to be honest, you have to put the disease into someone to have the immune system build up to fight it. So you have to put it in them for them to fight it off. So therefore, vaccines are harmful in some instances by putting the disease in someone's body.
Vaccines vaccines are the reason we use vaccines. That's what vaccines are. You're correct about that. Vaccines are using a non-harmful, non-lethal amount of that virus to into that person's body to help treat it. They use the virus to treat it.
And treating actually is curing. Just to point that out.
You said that the parents refused treatment for the baby, correct?
Yes.
Okay, well, although that is a tragic choice, is it not a choice to choose what you put into your baby? It is every person's choice to choose whether to take the treatment, and if they have more choices of healthier methods, what they think is healthier, they have more choices. If they're informed, then they can make choices that will save lives.
And when you have a vaccine, you have to be notified about what's going into the vaccine, what's put into the vaccine that's being put into your child. Therefore, when you sign the vaccine sheet, you're signing away your rights for someone to put a harmful chemical inside your child's body. Correct or incorrect?
Okay. People have used things like kava, which is a known herbal remedy from the South Pacific Islands, to deal with things like anxiety and other diseases. And kava has actually caused liver failure in otherwise healthy people and has caused allergic reactions, which has actually killed people. Furthermore, people who turn to home remedies don't always consult with their doctors, and they're taking these remedies without knowing the side effects to them, and so therefore it actually causes more harm.
You keep citing where home remedies have failed because of misinformation, but if this information was given by doctors, if it was shared and talked about with their doctors, it wouldn't happen, right? If they were
if doctors believed in home remedies, I think more of them would be vouching for them in the medical field. But doctors actually are not vouching for them, and they're rather turning to big pharmaceutical companies because those medications actually work.
In fact, an example of this is that Dr. Skylar Johnson from the Yale School of Medicine said that patients are increasingly refusing or delaying conventional cancer treatment in favor of alternative therapies. And as a result of that, their cancer is advancing, either getting larger or spreading to lymph nodes or spreading to distant sites. So this is an actual doctor from the Yale School of Medicine disputing this. As well, we have many other examples of doctors saying that home remedies do not make anything better.
And can you offer me an example where a home remedy has treated a cancer patient and helped them get over their cancer, please?
Yes, give me 1 second. Here it is. Sorry, wait. I have a first-hand account of a person whose mother had breast cancer. After her diagnosis, she took the advice of her oncologist at the Cleveland Clinic and underwent a mastectomy followed by many rounds of chemotherapy. I can still remember seeing my mom's hair fall out and thinking she had aged 10 years in a few weeks. All of her treatments worked and she was declared cancer-free, but in a few years, she had cancer again. So she started following an all-natural plan that included vegetable juicing, probiotic foods, immune-boosting supplements, stress-reducing techniques, and prayer. And after 4 months, the tumors on her lungs had shrunk significantly. And 1 year after that, she was again diagnosed being cancer-free and healthy. Now, 10 years later, she has turned 60 and she is healthier than ever.
Where did you get this from?
Wait. Did that person use the alternative therapy alone, or
Other treatments such as
had failed and she had got cancer again, she went to the all-natural remedy. And it worked.
Can you tell me where you got this information from, please?
I got it from doctor's blog. It's have you ever wondered how effective natural cancer treatments can be?
What's this?
Although there are some times when things such as herbal remedies may be used alone, usually doctors will almost always strongly advise that these treatments should only be used as complementary to conventional treatment and not as an alternative. So doctors recommend that it should not be used alone and in fact used with other types of drugs.
Not only that, you mentioned this one case about this woman who got her breast cancer cured, but I can say that 252,000 women got breast cancer cured through pharmaceutical remedies.
You asked, can you give an example? And we gave you an example. So you're saying our example is invalid?
No, yes, we agree that your example is valid, but we are trying to say that pharmaceutical drugs are better because they're more effective and more faster in curing these many thousands of people.
Because this could be a singular event. Can you offer us any statistics where you can prove that a large sum of people have been able to cure their cancer through various natural remedies alone?
I can tell you that you quoted that how many people survived breast cancer?
250.
You said about 250,000?
Sorry, could you repeat that one more time?
In 2017 alone, yes.
In 2017, okay. Are you going to comment on the 41,000 people that died?
We believe that it is tragic. However, we are trying to say these 252,000 people who survived, they survived through the bigger and conventional methods of treatment, whereas the people who would have used their natural remedies, how many of those have survived versus how many of those died?
And also, with your stating that this woman's mother had survived after juicing and home remedies, but where is the actual scientific correlation with that? How do you know that juicing was really what saved her? How do you know? Where's the correlation?
Home remedies, see, they don't take scientific readings. This may cause a problem when looking for hard proof evidence that you're looking for. However, the results they're cured. Why is this so hard to grasp?
It is not hard to grasp that someone gets treated or saved miraculously, but still, what we're looking for here are hard facts. Is this one more effective than another, and what is the actual proof that this thing is actually working?
We are asking because if we are able to see how they are cured, then we can decide really what is more effective than the other.
Other ways that cancer can be cured that was backed up by scientific evidence. I can read them again if you'd like. The melatonin, since its discovery 50 years ago, it's demonstrated its fully functional and diverse molecule that has antioxidant properties. The vast amount of experimental research that has revealed its vital role in the body's defense against numerous cell-damaging free radicals that it possesses 200% more antioxidant power than any vaccine. Or would you like to go to the baking soda or the organic garlic cloves, the apricot seed kernels, the cannabis sativa that early Egyptians, Persians, and even Greek civilization used? Or would you, the mainstream medicine in the USA is very slow to recognize this because the DEA absurdly claims that they are not correct, but it's been used for thousands of years. The cancer levels have risen, these vaccines and cancer treatments have been put into place.
Yes, because in recent years we have collected more data about it, which is why we don't have data from 1,000 years ago because people didn't necessarily know what cancer was. Furthermore, talking about natural remedies, when you have a tumor growing in your body, which is what cancer is, how are these natural remedies going to help you eradicate that tumor? In order to eradicate that tumor, you need to go through things like surgery and chemotherapy and all of those drugs combined to eradicate it.
Did quote things from thousands of years ago. Would you like something from 100 years ago, which we do? In the early 1900s, 1 in 20 people were had developed cancer. In the 1940s, 1 in 16. In the 1970s, 1 in 10. And now it's 1 in 3. This is rising. You cannot say that that is not in correlation with the cancer treatments or the cancer vaccines. I'm sorry.
You can't. Also, how can you necessarily prove that that's been rising because of modern pharmaceutical attempts to treat cancer? There have been, isn't it true that since the 1900s there have been vast technological and vast societal advancements?
Furthermore, talking about lifestyle, obesity has been rising since the 1900s, and therefore obesity has also been linked with cancer. And so this could be another reason why cancer has been rising, especially in North America.
There have also been more sexually transmitted infections, and if those are left untreated, they could turn into cancer. For example, hepatitis B or gonorrhea. Yeah.
To stop the cancer, we have to stop the cancer growth, correct?
No, we have to treat.
Well, okay, yes, we do. That's an effort of modern scientific treatments. We stop cancer growth, but then also it's an attempt to eradicate it in its form. Yeah.
Furthermore, natural remedies have been around for thousands and thousands of years. If they had proof to them working, then why were pharmaceutical companies created in order to treat cancer? If natural remedies were a perfect case to treat cancer, then that means that we've already cured it. But no, we still need these big pharmaceutical drugs because unfortunately these natural home remedies have not worked.
Actually, to your point, the communications and the marvels have increased in the past 100 years. And in these 100 years, who have been at the forefront? The pharmaceutical companies, the doctors, the research. Now, home remedies will be left in the dust.
Of the correlation, though.
There's also a study that shows that if you choose alternate cancer therapy treatments, the traditional methods being chemotherapy, radiation, stuff like that, it actually doubles the risk of death, says a study done by the University of, by the Yale School of Medicine by Dr. Skylar Johnson, who we talked about before. She has done a study that states that if you choose an alternate cancer therapy, it doubles your risk of actually dying or not curing it, basically. Sorry, we think you're muted. Are you talking right now? Sorry.
Can you hear me?
Yeah.
Okay. Where's she from? The doctor? Where is she?
Her name, sorry?
Yeah, her name and her credentials, please.
She graduated from the Yale School of Medicine. Her name is Dr. Skylar Johnson. She was the lead author of the study. He was the lead author of the study, sorry.
You cited Yale doctors repeatedly. Yale has funding from Yale's doctorate programs. They have funding from big pharmaceutical companies. This is kind of makes it hard to trust that information. You understand?
And I understand the whole
cigarette correlation with how it used to be healthy because big companies wanted it to be healthy. It's kind of hard to trust it when funding is directly tied like that.
I understand that argument, but you're saying that specifically because there's funding towards Yale, you're saying that they would purposely give out false information. You're not allowed. Doctors aren't allowed to do that. That's
they have a code.
They have a code. Sorry, say again.
They did it with cigarettes.
You did it with what?
Wait, okay.
Cigarettes.
With your continuous argument about not being able to trust these institutions and all these companies about how they have backing of all these pharmaceutical companies and them just trying to make money. But how does that really relate to all the great outcomes that are coming from these drugs, from these pharmaceutical technologies to cure cancer or to treat cancer? Because just because they are trying to make money or you feel that we can't trust them, you can't use that to eradicate the fact that these drugs are still treating cancer. They're still saving thousands of lives.
And most importantly, they are working.
They are working.
See, you said that they're helping. Well, big pharmaceuticals. A survey carried out by the nonprofit Access to Medicine Foundation found that 8 in 18 companies questioned said that they had set limits regarding how much antibiotic discharge could be released into the water. This is troubling because it said that can cause the superbug, and the superbug is projected to kill 10 million people by 2050. Sorry. That is something that they're doing with these drugs, with these chemicals, that is not helping, but actually harming. And these superbugs are actually making cancer worse, making things worse. It's making things more dangerous. So how can you say they're helping?
Okay. And what are they talking about?
Go.
Okay.
Okay. Antibiotics have revolutionized cancer treatment by enabling the use of more aggressive therapies. Although the misuse of antibiotics in human medicine has been well publicized, less attention has been paid to the serious overuse of antibiotics in agriculture. So these herbal therapies, they require herbs, right? And to cultivate them, you need antibiotics. So to ensure that they are safe to use, or they continue to grow, or they aren't damaged. So those actually increase antibiotic resistance also.
We would like to point out that we are not only arguing herbal therapies, these are home remedies. That includes as I've repeatedly said, we're using the Budwig protocol that has been certified by PhD holder Robert E. Wilmer with an MD. The Grayson therapy has been certified by a Nobel Peace Prize winner and Dr. Max Grayson. Also, the I'm sorry, it's very hard to say. The enzyme therapy that was certified. Proticulant enzyme therapy. The vitamin C that has been verified. I could go on. We're not arguing herbal therapies. We're arguing home remedies. While herbal therapies are one of them, if we could be more informed about which ones are safe, like the big pharmaceutical companies do not want, then we would know.
Memorial Sloan Kettering Cancer Center, the Cancer Institute of UK, the Drax.com and Cancer.com and Healthline have all said that the Budwig diet is an unproven anti-cancer treatment. There have been many studies on this treatment, and all of them have proven that that treatment actually does not work.
So are you and the others?
I named like 5 saying that they don't.
So are you implying that alternate cancer treatments don't work?
You referenced the Budwig diet, and I'm telling you that that specific one that you referenced in your examul has been proven to not work.
That specific one, or are you saying all in general?
You referenced something saying the Budwig diet. I am telling you that these various studies have showed that the Budwig diet does not work. I'm not going to say whether natural treatments do or do not work. I do not think they work. But according to what you have said, I am telling you that your point is incorrect, as over here there are 5 research centers saying that the Budwig diet does not work.
Well, since you say they're incorrect, alternate treatments for cancer seek to enhance the immune system and enrich the mind by giving the body what it needs: rest and immune-boosting ingredients. Supplement packages are a common addition to other vegetable and fruit-based diets, which my counsel just said, are natural for ability to fight infection and disease. Alternate treatments for cancer generally push a diet heavy in eggs and other proteins, grains, quinoa, and flax. So you're saying that alternate basically cures aren't working, correct or incorrect?
I'm saying that the Budwick diet that you mentioned is not working and has been proven by various sources.
And it might enhance your immune system, but it does not eradicate cancer.
And it's been proven by 5 very trustworthy research centers internationally.
Well, you can't say that they're not working because there's proof right here saying that they are working. Vitamins do not come from, well, they do come from vegetables, but vitamins in the vegetables are not from the fruit-based diets which have been brought by these sources that you're claiming. So you're saying that vitamins that are naturally made from the earth are not healthy. Correct or incorrect? In the fruit vegetable-based diet. Correct or incorrect?
How is that relevant?
How is that relevant?
You said the diet that my client, well, not my client, my partner said, you said the diet did not help. Correct or incorrect? It did not work. Correct or incorrect?
Yeah. Correct. Correct.
So you're saying your question isn't relevant. You brought up the diet. Therefore, I'm giving you facts about the diet. The diet does not come from just the vegetable. It comes from natural elements of the earth. So you're saying that the natural elements of the earth are not helping people cure cancer. Correct or incorrect?
You have to eat natural elements in order to live. Obviously, having a healthy natural diet will help you enhance your immune system, but that doesn't necessarily mean that will help you take away your cancer.
It's not, you can't take away cancer. There is no cure to cancer, but it helps prevent cancer.
It helps you live. Like brain cancer doesn't necessarily stem from having a healthy diet or things like that. Some cancers you can just get because you're genetically predisposed to them, not necessarily because you have a great diet. There's many people out there who have fantastic diets, who live a healthy life, who exercise every day, but yet they still get cancer. For example, breast cancer.
Jesus, help me, Jesus.
Yeah.
And you also talked about the superbug before, but there have been game-changing antibiotics that can kill off superbugs. They just require a bit more research to fully develop these arguments. But there have been, because of the funding that we use for the big pharmaceutical companies, there have been cases that they've used it on mice, and it's been used to kill off these superbugs that you talked about before.
What is? You're comparing mice to humans?
I didn't know mice could get cancer.
We're talking about research clinical trials. Like when you're researching this type of stuff to try to kill off drugs and stuff like that, you first do it on animals and then you move on to people. So I'm saying right now they're in the phase that they're using on mice and it has been successful in killing off the superbug that you talked about before.
Okay, I'm sorry. I heard you wrong. Very wrong. You said that, I'm sorry. You said, what clinical trial is this? Who's done it?
Who, sorry?
Who?
Who's done it? So the Center of Disease Control and Prevention, the CDC, have been working towards creating this antibiotic that will help kill off the superbug. They've been working towards it.
The superbug that was primarily caused by pharmaceutical companies?
Yeah.
So they're you agree that they're harmful?
What I'm saying is that sorry, say again.
You said that
Okay, to add on to our argument, no one is arguing that some of the pharmaceutical treatments that we've come up for various illnesses, some of them have been unsuccessful. Some things we do in the name of science have been unsuccessful, but that's all in an effort to further our pursuit of curing cancer, curing many untreatable, as we have it today, diseases. So there are errors in things, but from that comes new invention, and from that comes innovation, and that's how the world advances.
May I, you said that your point, that you're not arguing that the pharmaceuticals haven't messed up. So the home remedies have messed up, and that's all you're throwing at us. They made mistakes, and they're trying to go towards innovation and towards finding preventative measures for cancer. So how is that not innovative? If because it's not funded?
You're talking about making mistakes, but let me go back to the Budwig diet. The Budwig diet has also made mistakes because it says in it that you should increase your sun exposure, which has increased the risk of developing skin cancer. Also, the Budwig diet tells you to take coffee enemas, which are also can result in electrolyte imbalances and infections that inflame your lower digestive tract. So there are mistakes on both sides, both the pharmaceutical companies and different diets and herbal remedies that people have recommended. But the fact of the matter is that these remedies have been staying the same, whereas these pharmaceutical companies are taking strides and are taking measures to be better and to create new treatments in order to fight off these cancers and infections and other stuff like that that are harmful to humans. And we have the numbers. And we have the numbers to prove it.
Thank you. So you agree with my point that mistakes were made on both sides, but you said that they're taking leaps towards curing cancer. Can I read something? It's the, okay. I said it earlier in one of my earlier arguments. In 2010, pharmaceutical chemist John Hood had amazing news. The drug giant Sanofi brought Tergigent, and the company at which he headed research, for $650 million. They developed a cancer cure. This was in 2013, so why haven't we heard about it? Because when the company bought them, the clinical trials were said to have caused very high, to cause a vitamin B deficiency that causes confusion and loss of vision. But the people who participated in the trials and the scientist himself that was not affiliated with the company said that this didn't happen. Back to the argument that the pharmaceutical companies would like to cure cancer, would like to save lives, yes, but their bottom line is to make money. And you know how much money they're making off of chemotherapy, off of treatment, off of extensive and expensive treatments? They're projected to make $147.3 billion. That is in 2017, and it's looking to increase in the next couple of years as cancer cases are increasing.
How can you confidently say that all pharmaceutical companies are out there to just make money? They are making these drugs to help people overcome their diseases. They're not everyone out there is there to make money. You've brought this point up before, and as we have stated, over here in Canada, we have free healthcare. We work towards making drugs to help our people, not necessarily make money. These pharmaceutical companies are funded by the government.
And I'm sure in America there must be at least one pharmaceutical company out there that is curing cancer and is involving and creating such revolutionary medicines for the sake of money.
Furthermore, America is regarded worldwide as one of the best places to get medical treatment. The doctors and the care that you are given over there has been treated highly in the world. These people are there to help people and find drugs. They fund so much for research and everything in order to find new medications. So you can't confidently say they're just there to make money, because if they're just there to make money, that doesn't necessarily mean many people are being.
Even if they do make money, this is further further continued advancements, and we have the numbers to prove that thousands of people have been cured of cancer.
I can say with my aunt's lung cancer that they are looking for money, because when she couldn't pay for the treatment, they didn't give it to her. They're looking for money. That is.
I can say from experience that when I was 3, I almost died from mumps, but vaccine actually helped me save my life, and medication actually helped me as well. So experiences vary from person to person. We should look at greater statistics to get a better example of the general population.
Okay, then she just took out her own argument then, right?
Question. Hey, how many here have
Okay.
almost half of the people, I'm sorry, almost half of the people in this room, I just asked them if they've had people with cancer in their lives and half of them raised their hands. That is not a one-person experience. In America, this is happening to a lot of people.
Okay. So you're talking about, again, we have said before, talk about personal experience. You can't talk confidently like 7? I don't know how many people are in your room right now, but 7 people out of people around the world. You can't say, oh, so 6 people in the room raise their hand that they've had something like this. That's a sample. That's a very, very, very small sample. You have to look at the bigger picture like we talked about before. To look at other stuff, you can't. I think honestly right now we shouldn't talk about personal experiences because personal experiences aren't really relevant in what we're talking about as of right now. And
furthermore, you're talking about how from your experience, your aunt had lung cancer. I'm really sorry about that. You're talking about how pharmaceutical companies were trying to make money off of you. How do you know that they're trying to make money off of you? Because they were trying to give you medication. Furthermore, if we're talking about vaccines, to reiterate our points, they have done much more good than harm because if we look at all the people in the room right now, vaccines have actually helped us save lives and have actually helped us eradicate diseases like polio, like I mentioned before.
Your argument is what?
we're not right now. We're just rebuttaling the fact.
I know. What your side of the argument, if I could hear it?
Overall?
Overall.
Big pharmaceutical companies are better suited to cure diseases
than home remedies.
Cancer specific.
For cancer.
My side is in this debate to whether or not big pharmaceutical cancer whether their motives are not clear. It's like saying that, to say that these pharmaceutical companies want to cure cancer and to provide cures and vaccines is like saying that McDonald's wants to give food and drinks. They want to make money.
We're also just not arguing pharmaceutical companies and their drugs or chemotherapy, but what about also cancer treatments such as surgeries to actually eradicate tumors? So what about a brain tumor that's gone so far that the only way to remove it is surgery? Would you encourage that family or whichever person is suffering from that brain tumor to not get it surgically removed and use home remedies instead?
Also, we're just gonna state we're gonna wrap up in about maybe 5 minutes.
Yeah. Okay. I'm sorry. I didn't hear what your partner just said. What did she say?
I don't know what she said. She said. We'll give.
Should we iterate her point?
Basically, what I was trying to say was that people who go into hospitals with brain tumors, which is what cancer is, tumors.
Because many times these cancers are detected really late, so they necessarily don't have time.
Yes, so a lot of these cancers, the only way they can be treated would be, or at least the only way they can be treated, decided by doctors and medical professionals, would be to actually take out the tumor surgically. So how can you say, that's a case for many of people who go in for cancer treatment. So are those home remedies with diets or juicing, are those gonna help get rid of that brain tumor and help it stop to grow?
They don't cure cancer. They prevent cancer. They help prevent cancer. There's no other way to put it.
you're telling me that they're helping to prevent cancer, but like I mentioned before, there are many people who live very healthy lives, who are on strict diets, who are on exercise, who still develop cancer due to genetic predisposition and other factors that that impact them. It's not just all based off of diet and juicing and all of these herbal remedies.
I will concede the point on the diet. The takeaway. Most doctors agree that no diet can cure cancer. That said, more doctors than ever are becoming open to supplementing traditional cancer treatments for alternative medicine. In general, most people can benefit from eating less processed and refined food and decreasing their sugar intake. However, there might be products and supplements or a more nutrient-dense plan that would work better for you than adopting any diet. If you're interested, like, the doctors are now...
You just...
Yes?
Sorry. You just said to cure cancer, but before you were saying that these remedies were to prevent cancer.
I said that no diet can cure cancer.
No diet? Excuse me, could you please repeat what you said?
Your argument?
Repeat your argument on that, yes.
I was agreeing with you that no diet can cure cancer. That being said, more doctors than ever are becoming open to supplementing traditional cancer treatments with alternative medicine. Alternative medicine being,
Okay, but before that, you were talking about how a healthy lifestyle can help you prevent cancer. But now you're talking about how doctors are telling you to supplement these treatments with natural remedies. So, what are you trying to say? You're on mute. We can't hear you.
Oh, I'm sorry. No diet can cure cancer, but the natural remedies can help prevent cancer. There is no cure, but we are looking to prevent. This stuff helps. If you would like, I can read some things.
No, that's okay. We actually, once you're finished your point, we actually need to wrap up. So can we move on to conclusion? Once you're done your point, we'll let you finish.
Go ahead.
Yeah, you can do your conclusion.
Okay.
Sorry about this, just 1 second.
Okay, so our argument is that pharmaceutical companies and the pharmaceutical cures for cancer are superior to other types of remedies, as we have the numbers to prove that there are many types of variations of different cures for cancer. However, the cures for cancer that we have today are effectively treating it. And even though in maybe 50 years, maybe 100 years, we will find that cure for cancer, hopefully, it will be done through a pharmaceutical standpoint rather than a herbal treatment or some sort of herbal remedy, as we already have seen in today's day and age from the mentions of, for example, breast cancer. For example, breast cancer and meningitis. These things have been cured. For example, also the Spanish influenza, it's been cured through vaccines. And that's why that's why the 50 million people that died before, we're still all here today because of these pharmaceutical cures.
Conclusion. Do you want to do the conclusion? Okay. These alternate medicines, the non-traditional medicines, can prevent the cells from replicating. That is what we're going for. And they do not cure, like how you say vaccines cure breast cancer, apparently, but they're very good in preventing cancer, in stopping the cells from replicating, like baking soda. That is our conclusion.
Thanks.
Vaccines cure breast cancer. I want to look that up. Do they have something close? Because
we just want to thank you guys so much for having this debate with us and really teaching us the other side of the argument and getting us to think exactly how to argue with you guys, because you guys were really good.
Thank you very much, and we hope to sometime in the future debate with you again about another topic.
Thank
Thank
you.
you.
Bye.
You're good too.
Goodbye.
Bye.